Hello, welcome to my channel, Medical Assistant with Miss K. If this is your first time visiting, welcome. My name is Kendra, aka Miss K. I'm a medical assistant instructor. I teach both clinical and administrative courses. And if you are returning, welcome back. Today, I'm going to be doing a video that has been requested by several people. I've gotten a few comments from you guys and a couple of emails requesting that I go over coding. Today, I'm going to be talking about diagnostic coding, aka diagnosis codes, right? We're going to talk about that today, and then I'm going to do a separate video where I talk about CPT codes, aka procedural codes. Okay, so I just want to, give a disclaimer that this is just an introduction. If you want to get into more into billing and coding, into coding, period, you will need to find a program for billing and coding. Okay, because as a medical assistant and as a medical office assistant, we just learn the basics. Okay, we don't go into detail like you would if you were in a billing and coding program. Okay, so I just wanted to give that disclaimer. Now, these PowerPoints that I'm using, these are resources that I've got from a company called Health Center 21. They're a great resource for medical assistant instructors. I've been using them for a few years now. I've used them for my medical assistant courses, a few for my medical assistant courses, but mostly for my medical office. So if you happen to be a medical assistant instructor and you're looking for some resources, Health Center 21 is a great resource. I just wanted to shout them out. All right, so let's go ahead and get started. First of all, diagnostic code. And what is a diagnosis code? Let's just look at that right now. So just to let you guys know, I'm going to be going from two different PowerPoints. So we're going to go through this. Both are short PowerPoints. So this presentation, this lesson won't be very long. I'm going to go through this one, and then there's another one that I'm going to go through right after. Okay. All right. So diagnostic code. And first of all, what is a diagnosis code? Those are codes that refer to the physician's diagnosis, right? So why are diagnosis codes important? Because the diagnosis code tells the insurance company why the provider did what they did, right? It tells the insurance company why they are paying that provider or reimbursing that provider for that service. Okay. So it is very important, you guys that are going to be getting into coding, it's very important to make sure you understand this, and also to make sure that you have the correct coding. Okay. Now, the diagnosis code does not determine how much the provider is paid. That is what the CPT code does, which we'll talk about in another lesson, but it does ensure that the provider gets paid. So it's very important to pick the correct code, because that diagnosis code has to match what the provider did, right? For an example, if a patient came in for a simple headache, or maybe they're in a stomach ache, and then the provider ordered an EKG, it won't make sense to the insurance company why an EKG was ordered when all the patient had was a headache. So the diagnosis code, again, is what justifies payment to the insurance company. Okay. And as you can see here, it says the diagnostic codes aid in the insurance claims process. The actual amount of payment received from the insurance company is based on the procedure. However, the diagnostic code will indicate why the procedure was performed. So some people, they get diagnosis codes and CPT codes mixed up. But remember, diagnosis codes or ICD-10 codes tell the insurance company why. CPT codes, aka procedure codes, tell the insurance company what. If you can remember that, then you'll know the difference between the two. Okay. So, for instance, if a provider bills an insurance carrier for putting an arm in a cast, but the diagnosis does not show a broken arm, maybe it shows a headache, they're going to deny it, because they're going to say, why are we paying for this patient to have to get a cast on their arm when all they had was a headache? Okay. So we have to make sure that the diagnosis code justifies what the provider did. Okay. Now, that doesn't mean that we want to commit fraud or abuse, right? Which is coding an incorrect code just to get paid. Now, let's just be real. It happens. There are some providers out there who have been guilty of that, and it's called fraud. Okay. So we don't want to do that. If the diagnosis code does not match the CPT code, then there is no justification. We can't bill for that procedure. Okay. All right, so let's talk about primary and secondary diagnoses. Okay, so in some cases, In some instances, there will be times where a patient is in for more than one thing, right? So the primary diagnosis, that's going to be the one, that's the main reason why the patient came in, okay? Now, for those of you that's going to be filling out claim forms, you're going to be in billing and things like that, you got to make sure that you list that primary diagnosis code first, okay? So that's the main thing the patient came in for, right? So if we look at this picture over here, it says primary diagnosis is pharyngitis, right? So that means that the patient had, we know itis is inflammation, right? And so pharynge refers to the pharynx, right, or throat. So that means that they have inflammation of the pharynx, okay? So that's the primary diagnosis. That's the main reason why the patient came in. So when we fill out that claim form, we got to make sure we list that first. Why? Because most likely the doctor probably ordered some type of test or maybe ordered a medication for that, okay? And again, it has to be justified with a diagnosis code. So an insurance company, they want to look at the primary diagnosis code first, okay? Now notice this person also has hypertension. What is hypertension? High blood pressure. So that's even though that's not the main thing that the patient came in for, that's still one of his or her diagnosis. So we want to include that. So secondary diagnosis, there was going to be other things that the patient has going on, right? Or in this, as it says here, that coexist with the primary condition. Okay. So one of the things that you will need to know for those of you that's going to be taking a certification exam, there is a question that asks how many diagnosis codes can go on a claim form, and there can be 12 codes altogether. Okay. So you have the primary diagnosis code, which is the main reason. That's the one you want to list first. And then the secondary diagnosis code, right? That's the other diagnoses that coexist. Up to 11 secondary diagnoses can be entered on a claim. So you want to make sure you know that that is a certification question. All right. And this is just saying here, just reiterating the fact that we want to make sure we list the primary code first and then the secondary diagnosis codes later. The order of the secondary diagnosis codes is determined by the specialized code and guidelines for each type of diagnosis reported on the claim. A secondary diagnosis should not be reported unless it is relevant to that day's treatment or service. Okay. So the reason why hypertension was included with this pharyngitis diagnosis is because the doctor has to consider the fact that that patient has hypertension, right? And there are some medications that patients can't take when they have hypertension, some decongestants that patients cannot take when they have hypertension. So this is why that physician needed to list that there, okay? Because it does relate, it is relevant to the services, because if that doctor gives a certain medication to that patient for having pharyngitis or inflammation of the throat, they had to take into consideration that certain decongestions they cannot prescribe because of the hypertension. Okay. Um, let's see. All right. So volumes of the ICD-10. So the ICD-10 CM manual, that is the book that you guys will be using to determine the diagnosis code for the patient. And this is for those of you who probably will not probably, but this is for those of you who will definitely have to go in and code yourself. Now, for the most part, if you're working in a doctor's office, the physician or provider, and I say provider because remember, provider is refers to physician, nurse practitioner, as well as a PA. So you could be working for any of those, right? So the I kind of lost my train of thought for a second, but for the most part, they are going to indicate the diagnosis codes for you, so you won't have to use a manual. However, you still need to know how to use it just in case. My very first job, we were responsible for, searching for the codes if the provider did not give it to us, because she didn't always give us the code and we had to use the manual. Okay. So these next few slides and then the next lesson, I believe, is it will, kind of go over how to code in the manual. But like I said, in some instances, the provider will give you the code and you won't have to do any of this. Okay. But anyway, so the manual is divided into two volumes. You have volume one, which is the tabular index. That's the list of diagnosis codes in numeric order, okay, or diagnostic codes in numeric order, right? Volume two And please forgive me, you'll hear me say diagnosis codes and diagnostic codes. Same thing, okay? Volume 2 is the alphabetic index, okay? That's the alphabetical listing of all known diagnoses, okay? So there are two different manuals, which is saying here the PCS coding is used in inpatient settings, and then the ICD-10 CM is used in the office setting. So what we're talking about is the ICD-10 CM right now, which is used in the medical office. But anyway, so you're always going to start off by looking in volume 2 first because it's listed alphabetically, right? So once you go to volume 2 and look for your codes, then you're going to cross reference it in volume 1, which we'll talk about again in a minute. Okay. So this is how volume 2 is broken down. It's broken down into 4 sections. You have the index to diseases in section 1. Section 2 is neoplasm table. Section 3 is index to external cause of injury and poisoning. And then section 4 is a table of drugs and chemicals. All right. So let's talk about we're going to talk about in a second how we go look for the diagnosis code when we have to figure it out, right? So again, as we mentioned, it's listed alphabetically by main terms. Now, main terms, I will tell you this, is not body parts. So when you're going to go look for a main term, let's say the patient came in for chest pain, okay? We're not going to go to the ICD-10 manual and look for chest. We're going to go look for pain. And then we'll have to go down to the modifiers to specify for chest, okay? Non-essential modifiers, those are modifiers provide alternate terms or further specificity. Essential modifiers, which must be added to increase the level of specificity. And then you have qualifiers, which can be added to increase the specificity of essential modifiers. Now, you guys know, well, you should know that diagnosis codes can be anywhere from 3 to 7 characters, right? The more characters you add, the higher the specificity, right? Or in other words, the more specific it is, the more characters you have, the more specific it is, okay? So let's look at this. So main terms are listed in bold, right? Main terms can be diseases, conditions, or eponyms. So it's never the actual body part. It's the condition or the disease or an eponym. What is an eponym? That's a disease or procedure or syndrome named after a person. For an example, Parkinson's disease is named by James Parkinson. Okay. And so anytime you see eponym, that's just referring to a disease, procedure, or syndrome that's named after a person. Okay. So as I mentioned, main terms are not parts of the body. Okay. So if a patient was diagnosed with a rash on the face, the main term is going to be rash, not face. So remember that. That is a test question. So just to let you guys know that as well. All right, so let's look at this. So essential modifiers, non-essential modifiers, and qualifiers. So let's look at this. So for an example, rash. So let's say baby has a diaper rash, right? So we're not going to go look for we're not going to scroll through. I say scroll. You guys know I'm used to, we're so used to electronics now, but you're not going to go through the manual and look for diaper. We're going to go look for rash, okay? Because that's the condition. So once we find rash, right, that's the main term is rash, okay? Now look at this. What kind of rash is it? This is the essential modifier. Essential, something that is essential means important or necessary, right? So we have to make sure we include that. We have to be as specific as possible. So to just say rash, if we were to just code rash R12, that's not specific enough. Okay. We have to add the essential modifier. What kind of rash is it? It's a diaper rash, which is L22. Okay. So that's the essential modifier. And as we learned on the slide before this one, non-essential modifiers, they don't necessarily have to be added. So notice how this says toxic, right? And then the qualifiers, it adds more information, right? So let's for an example, say, okay, so let's say the baby has a rash, right? So we specify diaper rash L22. How did the baby get a diaper rash? Well, it was following immunizations, right? And so that would be T88.1. So that's being as specific as possible. The baby got a diaper rash after immunizations. Okay, so those are qualifiers. Qualifiers are used to add even more information. So when you guys see on your You guys will see when you guys go take the certification, it'll ask, what do modifiers do for a diagnosis code? It makes it more specific. Okay, the more codes, the more characters in a code, the more specific it is. Okay. um when we kind of touched on this, I don't know if we didn't touch on qualifiers in the last slide, but this will appear. And then underneath essential modifiers, it increases specificity. They should be used if they more accurately describe the diagnosis. Before assigning a code, assistants should read through all the qualifiers, meaning you look through all of them and see which one applies. Okay. And so this is the end of the first lesson. Remember, I told you guys I'm going to go over 2 different PowerPoints. So this is just to be, this is the end of the first lesson. So in summary, a primary diagnosis code is the most significant condition for which a patient is provided service. You want to list that code first, okay? Always list that code first, and then you want to list the secondary diagnoses, okay? And remember, up to 12 diagnosis codes can go in a claim form. Now, if you haven't seen a claim form yet, make sure you check out my video that it's titled the difference between an encounter form and a claim form. And the reason why I did that video is because many people get those mixed up. Okay, so make sure you check out that video if you've never seen what a claim form look like. If you're in school, you probably seen one because you guys have probably gone over it anyway, but just in case you haven't, make sure you check that video out. Okay. All right, so I'm going to stop sharing my screen for just a moment, and then I'm going to pull up this other I'm going to pull up the other presentation. And then, guys, just let me know if you happen to have any questions or anything. Like I always say, you can, leave your questions down below. You can email me. Either way is fine. Okay. All right, so performance. So we talked a little bit about an introduction to diagnosis coding, right? Or diagnostic coding. So as I mentioned, it's anywhere to 3 to 7 characters, right? The more characters you add, the more specific it is. Modifiers makes it more specific, right? And what is a diagnosis code? It tells insurance company why, okay? Diagnosis code, aka ICD-10 code, okay? And the ICD-10 CM, this is the manual that you're going to use to find your codes, okay? For those of you who have to do coding. And you guys are going to get more into detail. Those of you that's going to be taking billing and coding, you guys get more into detail. And, you get quite a few textbooks, and you got, it's very, what's the word I'm looking for? Kind of tedious when you're taking billing and coding, but it's worth it. The good thing about getting a certification in billing and coding is that I know of people who have their own businesses where they become third party billers for doctors' offices, where, they have contracts with doctors' offices and they do all of their billing for them. So it's a great certification to have. All right, guys. So let's get into this. So how do we perform diagnostic coding? So first of all, I mentioned there's 2 volumes, right, within the CMA. We talked about volume 2 before, which is the alphabetic volume, and that's the volume that you want to go to first. Okay. Once you go and you you find that code in volume 2, then you go to volume 1 and you want to cross-reference it to make sure you have the correct code. Now, volume 1 is broken down numerically, right? And so there's 21 sections. So this slide right here just breaks down some of those sections. You got certain infections and parasitic diseases, disease of the eye and the nexa, disease of the ear, disease of circulatory system, and then 11 through 21 is here: digestive system, childbirth, let's see, injury, external causes. Okay, so these are just the 21 volumes. And again, those of you that's going to get into billing and coding, you guys are going to get more, you're going to go more into detail with those things. So we're not going to touch on that here. All right, so using external cause of injury code. So these are code that indicate the circumstances surrounding the injury, right? So how did the injury happen? So this part, chapter 20 within volume 1, that's where you'll go to find the code that will indicate what happened. These codes should never be used as primary diagnosis code, right? So let's say the patient broke their leg, right? So that'll be the primary diagnosis code. And let's say they fell off a ladder or whatever, and that is included in the cause of injury, then that will be listed at more of as a secondary diagnosis code. Okay. So the primary code should be the current condition, right? Such as the fracture, All right. The external cause code should then be used to describe how the injury happened, the patient's activity when the injury occurred, and then the place of occurrence of the injury. Okay. And then the patient's status when the injury occurred. So, like workers' comp, right? So, in instances where a patient is injured on a job, then we want to indicate that the injury happened on the job. So, we'll find external code that indicates that it happened on the job, right? Some third-party carriers prefer that external codes are not used on the claim. Before coding from the section, be sure the third party allows it. Also, some states require external cause codes. Be sure to know your state's requirements before using these codes. Again, so much more to billing and coding, right? Than to just bill and to just bill and code, right? And so that's why I said this is just an introduction. For those of you that's getting into that program, you'll get more into detail and learn about what states require and what don't, and and things like that. So don't worry. All right. So symbols and formatting in the volume one CM. All right. So three in volume one, 3-digit category codes are listed first by the letter in alphabetical order. So as you can see here, these are the H codes. And then within those, they'll be listed numerically. So like as you see, this is H, right? And so 35.4 is listed first, 35.5, 35.6, and so on and so forth. Okay. Um, Fourth through sixth character subcategory and subclassification codes are indented underneath. Okay. If a seventh character is required for a code, there'll be an indicator box to the left of the code heading, which instructs the user to add an additional character to the code. Okay. These additional characters are found at the beginning of the code category or subcategory. All right. Now, volume one uses many different indicators to make certain types of codes are easier to recognize. For an example, yellow means that it's unspecified. Okay. So this means that it's unspecified. All right. This means that the diagnosis was not further specified in a physician's notes. Okay. Now, if you see gray codes are used for other. All right. This indicates that the diagnosis was more specific, but there is no code that exactly matches that level of specificity. And then text highlighted in blue indicates a manifestation code. And a manifestation, sorry about that, that's an illness or condition that's caused by an underlying illness or condition. So, like if a person has, let me just see, like for example, if a person who has HIV, they have a compromised immune system. So a manifestation could be maybe kidney failure, and things like that, because they have that underlying condition. They have, something like HIV or some other um, immune disease that will cause other conditions, right? Because when you have an immune disease like HIV, your immune system isn't working like it should, and so you are much more susceptible to um, to develop other illnesses and conditions. Okay, so any illness or condition that is caused by an underlying illness or condition, even maybe cancer. All right, so determining the diagnosis. How do we determine the diagnosis? First of all, if you have a super bill, aka encounter form, and you definitely need to know that that is a question you may see. What is an encounter form, or another name for encounter form is super bill. Okay, so this is going to be the easiest way to get the diagnosis codes. If your provider has checked off the code on your encounter form, you have your code. That manual that we talked about, you don't even have to go in that manual because you have your code. The manuals are needed when you don't have the code, okay, and you have to do the coding yourself. But in a perfect scenario, and I say perfect scenario because you have your code right in front of you, all you're going to do is use the codes that are on the encounter form. And again, as I mentioned, I have a video that shows you guys the encounter form versus the claim form. Now, encounter forms, they're specific to the practice or specific to the specialty. So they're going to be a list of, diagnosis codes, CPT codes that are commonly used in that specialty. All right. If for some reason the code is not listed on here, the provider will write it in. Okay. So this is going to be the perfect scenario. This is the first step. Okay. Super bill. Now, in some cases, you may not get that. You may have to go through the physician's notes to get your codes. Now, and as I mentioned, my very first job, I was hired on my externship in the GYN office. Many times we had to go through her notes, and she had a nurse practitioner that worked with her as well. We had to go through their notes to find the codes. Now, after a while, because I was so used to it, you get used to it, and certain things, depending on a specialty, you automatically know the code. If it's the same code you see all the time, then you already know it. All right. So this is going to be another step you may have to take, is looking through the notes. Okay. And then, as it mentions here, with more doctors using electronic medical records now than ever before, it will not be as difficult to determine the doctor's handwriting. And again, most of the time, the codes are already there for you. Even if it's not on a super bill, the doctor, most electronic systems, the provider has no choice but to choose a diagnosis code. Sometimes it won't even let certain tests be ordered in the system without them choosing a code. All right, so when entering a code, don't disregard zeros. So if zeros are present in the manual, they must be included. For an example, if a code is Z00.00, the assistant must write Z00.00, okay? It is also important to know that codes will never begin with a zero. So let's just say a provider writes a code or something, or, maybe you get an order. Maybe you work, like for an example, I worked at a lab, at LabCorp, and patient would come in with handwritten orders, and the diagnosis code will be handwritten, and the zero could look like a O or vice versa. We already know that codes will never begin with a zero. So if you happen to get a handwritten order and it looks like a zero, then just know that it's a O. Okay. And also, the reason why I wanted to point out not to leave off these zeros, because somebody could look at this and think that they don't need to include those zeros, because as you know, when we're listing numbers, for an example, like $100, right? We don't necessarily have to list those two zeros after the decimal, but just remember, codes um are not like numbers, in the sense that we cannot leave those two zeros off, though they are there for a reason. Okay. All right, so coding that diseases and conditions. As I mentioned, we want to look up the condition, not the body part. Okay, so when you're doing coding and you got to go look for the code yourself, remember, you're not going to go look for the body part. You're going to look for the condition. Now, and I will mention here, and like I said, I'm going to do another lesson on CPT codes, procedure codes, but with those, you can look up a body part, which we'll get to later when I get to that, when I go over that lesson in a separate video. But anyway, so let's look at the example of a fractured clavicle. So let's say a physician diagnoses the patient with an open fracture of the clavicle shaft. The clavicle or collarbone shaft is an anatomic part, a body part, so that's not going to be the main term. The first term is going to be fracture, because that's the condition, right? So we're going to first look up fracture, okay? Now, once we look up fracture, because the fracture is of the clavicle shaft, then we're going to look up clavicle, because we're going to look at, okay, fracture, a fracture of what? Okay, fracture of the clavicle. So that's the first modifier. Okay, then what part of the clavicle? The shaft of the clavicle, right? It's the shaft of the clavicle. Okay, now we know the clavicle is the collarbone. Okay, now below shaft, there will be a qualifier that says open. Okay, so let's just look at that again. So we're going to look up fracture, because fracture is a condition. Okay, so open fracture of the clavicle shaft. Fracture is the condition. So we're going to find fracture. Okay, fracture of what? The clavicle. Okay, now what part of the clavicle? The shaft. Okay, so we're going to look for the shaft. Now below shaft, the qualifier that is going to say open, because is it an open fracture or a closed fracture? This is an open fracture. Okay, if it was closed, we would choose closed, but this is going to be an open fracture. Okay, so I just want to make sure you guys got that understanding. Okay, again, this is just an introduction to coding, but this is just at least going to get you in the door. So if you have the code, at least you're going to go look for the condition, then the modifiers, and then the qualifiers. Okay. Now, in some cases, Chapter 21, factors influencing health status and contact with health services, some diagnosis codes, this is so important to mention, some are not going to be conditions. Okay. Some are not going to be diseases or anything like that. Some people may just came in for a physical. Okay. So you're going to choose the appropriate diagnosis code that the patient just came in for a physical, like a well woman exam, or pediatric physical, okay? Or maybe the person needed a vaccination. There are certain codes that indicate that. So that is the primary diagnosis code. There's nothing wrong. They don't have any pain, no diseases or anything like that. They just simply came in for their routine visit or vaccination or screening, okay? All right. These codes are used to describe factors that may influence a patient's health status, such as family history. That is one. So when I worked in cardiology, we got a lot of patients, and I still do as needed work in cardiology, but we get a lot of patients who maybe only came in because they have a family history of heart attack or heart disease. Okay. So that is also a diagnosis. They don't have any chest pain, no palpitations, nothing's wrong, but they're simply getting checked out because they have a family history of heart disease. Okay. So if a physician orders a diagnostic test to detect asthma, the physician must give a reason as a diagnosis code. The reason may be that the patient has a family history of asthma. So just know that not all diagnosis codes are going to be diseases or conditions, okay? All right. So to prepare for performing a diagnosis code, and this is for those of you who will have to actually code, okay? You want to prepare for the procedure, determine the diagnosis, use the ICD-10 CM, and then assign the code. So what are some ways you prepare? You may have to gather some supplies, which is the physician's notes or the patient's super bill or encounter form, and then the ICD-10 manual if you need it, if the codes are not indicated on the super bill. So how do you determine the diagnosis? Again, we talked about going to look for the main term, which is not a body part, right? It's going to be the condition. Then you're going to be as specific as possible, okay? So you're going to summarize the diagnostic statements from the patient's records using the super bill, notes, and other related reports. Determine the physician's diagnosis. Make sure everything billed to the patient and to the insurance carrier is documented in the medical record. So you never want to choose a code that is not documented in a patient's medical record. It has to be documented, okay? If an insurance company comes back and needs more information, like a copy of the medical record note, then that notes that patient's visit for the day should indicate that code, okay? Identify the main term within the diagnosis. Remember, it cannot be an anatomic site, okay? So you got the diagnosis. Use the manual, locate the main term again in volume 2. Then you're going to cross-reference in volume 1, okay? You're going to represent in volume 1. Assign the code, which you're going to document it on, you're going to enter it in on the claim form, okay? Now this here is saying document this code on a super bill in the patient's medical record and the claim form. This is for those instances where you have to fill out the super bill, okay? So again, perfect scenario, the provider has already filled that out, all right? And then you're going to write that information on the claim form. And again, you guys know the claim form is what we fill out to send to an insurance company so the provider can be paid or reimbursed, okay? Once you do that, you're going to return the supplies to the proper place. Okay. So, in summary, the ICD-10 CM contains 2 volumes. We have volume 1 and volume 2. And then volume 2 is going to be where we're going to go first. Once we find that, like we saw that diaper rash was, what was that? L22. Whenever you find a code, you always want to go cross-referencing in volume 1. So L22, you're going to go look for that in volume 1. You're going to look up L22 and you want to make sure it says beside it diaper rash, okay? Once the diagnosis has been determined, its main term should be found in volume 2. Then the number must be cross-referenced in volume 1 to make sure the code is as specific as possible. Be specific as possible when you are coding. And again, I mentioned it several times. The perfect scenario, the provider will already provide it for you. Once they give you the code, there's no need to go and cross-reference or do any of that because they have given you the code. You already have it. The super bill is filled out. All you're responsible for is entering that information on the claim form. Okay. So I hope this was helpful for anyone who needed maybe a refresher in the introduction to diagnostic coding, or maybe this is your first time ever even learning about it. For those of you that's getting into the program, you get so much more into detail. I am not a biller and coder. I've never taken a billing and coding program. As a medical assistant and medical office assistant instructor, we only scratch the surface. Okay. So I hope that this was helpful. If you have not already, make sure you subscribe. If you want to hear more from me, on this channel, I focus on all things medical assistant, lectures, um, and certification, exam prep. If those are things you want to hear about, Make sure you subscribe to this channel to hear more about that. If this video was helpful to you, please like it. If you have any questions or video suggestions or anything like that, feel free to email me. That'll be listed down below. And you can also comment in the comment section. So I thank you all again for visiting my channel. Be blessed.